Okay, ¿qué pasa amigos? ¿Cómo están? How are you? Okay, today I wanted to show you, this is going to be very good in your practice. I wanted to show you some new things I found that were currently released for dry eye, for severe dry eye. And it's very promising. I'm looking forward for it to be commercially available here in Latin America. As you know, I am in Guayaquil, Ecuador, a very exotic country. I hope you come someday. And with no more dilation, alio. Okay, I'm going to share you this to show you. Wait. Just wait. Okay, that's it. That's it. That's it. I'm going to show you here. Here. Right. Okay. Okay, here you can see, I'm going to start with this one. Wait. I'm going to start with this one. This is the BioTissue Cam 360 amniograft. This is from a very known company, very well-known company named BioTissue. If you remember, BioTissue have a very famous study that's called DREAM. It's called DREAM. In 2018, it was released. And the results was a very good study. The results of this study were very promising in his amniotic membrane product of that time, healing the ocular surface. So it's a very, very nice thing to have for severe ocular dry eye and for neurotrophic keratitis. So now they just launched commercially available this Cam 360 AG. It's very nice. It comes in a bandage contact lens, and the amniotic membrane comes inside, and it's stuck in the contact lens. So you can put this contact lens on the eye with neurotrophic keratitis, severe dry eye disease with ulcers and punctate keratitis and everything, severe dry eye. You know how terrible is severe dry eye. And you can leave it there and you can have all the benefits of amniotic membrane. So I am really eager to try this one, really eager to try this one. And I hope we can see it soon available here in Latin America. So stop sharing. Now, I want to show you the other thing I am share screen right here. The other thing I am excited about. See? No, un ratito. Vale. I'm excited about. This is from a company called Nordic Pharma. It just was commercially launched, and this is for treating dry eye disease again. And this is not, remember, not every dry eye disease is the same. This is for aqueous dry eye disease, you know. So here, what you do is that you occlude the canaliculus system with this pre-filled sterile syringe with 2% sodium hyaluronic acid. So here's the thing. But Luis, you can put punctal plugs. It's not a big deal. Yes, it is, because punctal plugs, they drop, you know, they drop off. Patients come to the visit, and the punctal plug is gone. Second, they can get infected. It's not that frequent, but they can get infected. And third, you have to fit the right size because not every punctum is the same size. So it's kind of this is kind of a game changer, because here you have, in my pre-filled syringe, you have 2% hyaluronic acid, and you inject it in the canalicular system. One fits all. This is the secret. One fits all. And it's supposed, I haven't tried it yet. It's not available here in Latin America. I hope to get it soon, and I will let you know. It's supposed to last for 6 months. And for you guys in US and in Europe, this is reimbursable. This is reimbursable. The secret of this is that I haven't tried it, but if you follow me, I know my viscoelastics, my OVD. This is a high viscosity OVD. As you know, I have shown you before, OVD viscosity is it's a mix between the molecular weight of the OVD and the concentration. So what you have here is a high molecular weight and 2% hyaluronate, and you have a very high viscosity OVD. So this goes into the canalicular system and stays there for 6 months. That's what the companies say. Remember, you have to be critic. You don't have to believe everything the industry says. Here, at least here, I'm gonna tell you everything. I don't shut up, and we have to try it. We have to try it, and let's see if it lasts 6 months. But it's supposed to last 6 months, so I am really looking forward to try this. I'm gonna try to get this as soon as I can, and of course, I will let you know. Okay, I will stop sharing, and that's it. That's the current treatments for dry eye of June. I'm really happy I found this, and I hope to see you again. You have to press down here the like button, and I hope to see you soon. Subscribe. Bye. Cerramos, chiringuito.